So if a guy comes into the clinic and they are concerned that they have low testosterone, for you, what does that conversation look like, and what is that patient journey, going to look like moving forward?
Yeah, so different options. I mean, some guys come in and they've never been tested before, and they have these symptoms and they're just interested in getting tested and seeing what those options are. Other guys have had a testosterone checked with their primary care or something, and it was low or borderline. And so then they're coming to us again to talk about what does this mean and what are my treatment options. Some guys used to be on testosterone and for whatever reason went off of it for a while and want to get back on it. So a lot of different places where you can start, but then it's all again reviewing what symptoms are you having, have you taken any type of steroids before, how long have you been on them or off of them. But also a big important question is fertility. If they're interested in preserving fertility. And I've unfortunately seen guys who have gone to a low T clinic before or something, and they were started on testosterone, never told about the relationship with testosterone and fertility. And, I had a guy who we checked a semen analysis and he had 0 sperm.
Yeah.
And, so that's a very important place to start, because then if they have low testosterone, it's going to be different treatment plans for guys who want to preserve fertility versus guys who don't. So definitely getting a good history on your patients is always important. And then if they have low testosterone, talking about your different treatment options, which a lot of different options there. And you just kind of, have that conversation and figure out what's best for that patient.
Yeah. Yeah. I think it's really good that you brought up the issue of fertility because I just got a message today from a patient asking about how they could improve their fertility. And they asked if starting on testosterone would help out their numbers. And what's, a little spooky is that that misconception doesn't just come from patients. There are a lot of doctors out there that think that testosterone boosts fertility, when in reality, it does the exact opposite.
Yeah.
Yeah. I mean, the way that I explain it to patients is that your testicles only have 2 jobs: make testosterone and make sperm. And whenever your body sees a lot of testosterone in your circulatory system, it just says, hey, I don't have to do my job anymore, right? And it just
Sit back and
completely,
relax.
yeah, sit back and relax, totally shuts down. And as a result, your pituitary stops making the FSH and LH that your testicles need in order to be stimulated. So it's kind of like you just give up on watering a plant. Like, yeah, you could probably get away with that for, a couple days, maybe a week or two, but you're pretty soon going to have some significant side effects, which is why men who have been on testosterone for a long period of time, if they're not on something additional like HCG, they're going to notice actually atrophy and shrinkage of the testicles. Okay. All right. Let it be known that testosterone does not shrink your penis, but it will shrink your testicles if you are not on some sort of adjuvant therapy. And the AUA guidelines even explicitly state that if you are trying to get pregnant, that you should not be on testosterone therapy. There's some nuance there. There are some ways that you can work around. Yeah, you can, obviously in our practice, we can talk about like using HCG at the same time, gonadotropins like FSH, the benefit of like oral testosterone, short-acting oral testosterone within clomiphene. But generally speaking, testosterone and fertility don't mix very well.
Yeah.
Yeah.